Hello, I'm Dr. Stephen Myers. I'm the bariatric surgeon at Fresh Start Bariatrics at Riverside Methodist Hospital here in Columbus, Ohio. And I would like to spend a few moments talking to you about the dangers of consuming alcohol after some bariatric operations. I brought with me a bottle of wine and also a wine glass. And what I can tell you is if you choose to have a gastric band operation, really you have not changed the anatomy of your stomach or your small intestine, so you really don't have to worry about the results or the dangers of consuming alcohol after gastric bypass, after having a gastric band procedure. However, it still isn't a good idea because alcoholic beverages have a lot of calories and the band won't help you to hold that back, so therefore you're going to absorb all of those calories very quickly. But at least you're not going to expose yourself to additional dangers after a gastric band operation. Now that's very different than having a gastric bypass operation. A gastric bypass operation is different because there is a very small gastric pouch, and what you swallow in regard to what you take in regard to alcohol is going to go directly through the esophagus, through the small gastric pouch, and immediately into the small intestine. That means you're going to absorb that alcohol very rapidly. Now let's use a comparison. Right now, if you have not had bariatric surgery and your stomach is of normal size and normal anatomy, or you've had a gastric band, what will happen is you will slowly absorb, and you take, for instance, a half a glass of wine or something like that, or a glass of wine. You will slowly absorb that over time. Your alcohol level will slowly come up and slowly come down. However, after a gastric bypass operation, what is going to happen is you're going to drink that alcohol. It's going to go directly through the esophagus, past that small gastric pouch, directly into the small intestine. And the small intestine is very effective in absorbing things like alcohol. What will happen if you've had a gastric bypass and you take a glass of wine is you will absorb all of that alcohol immediately. Why? Because it's not stored in the stomach, because the stomach is bypassed, and there isn't an enzyme called alcohol dehydrogenase to break down a lot of the alcohol. So you'll absorb all of the alcohol almost immediately after you swallow it. What I tell my patients is if they have a gastric bypass operation and they drink half a glass of wine or a glass of wine, they'll be way over the legal limit. Secondly, they will be drunk as a skunk. And I mean, they'll be doing things that they hope people would never say that they were doing, dancing on tables and all that kind of, it's just a bad idea. So if you have had a gastric bypass operation, I would encourage you to consume very small amounts of alcohol. You can dilute it and drink a little bit of it, or you can drink it very slowly or avoid it altogether. But gastric bypass and alcohol is just a very bad combination. So I would encourage you to think about that before you have a gastric bypass operation or any gastric operation or bariatric operation. Finally, I would say that if you choose to have a gastric sleeve, which is becoming more common in our practice, I would just say that it's very similar to having a gastric bypass operation, and you should again be very careful with your consumption of alcohol because your stomach is going to be much smaller, it's going to empty much more quickly, and the alcohol will be absorbed very quickly. So I hope this has been helpful to you. This is Dr. Stephen Myers, the bariatric surgeon at Fresh Start Bariatrics at Riverside here in Columbus, Ohio. Thank you for your attention, and I hope you have a wonderful time as you continue to recover from bariatric surgery, or I hope you make an excellent choice of which operation is best for you.